Hey, San Diego, this is Dr. Jason Shumard with Integrative Wellness Center. And today I've got an amazing topic that I want to go over with you. This topic is going to be so amazing. I hope that anybody who is watching this right now, who is just coming on, if you are suffering with type 2 diabetes, if you know somebody who is suffering from type 2 diabetes, you want to make sure they watch this video. You want to make sure they're on this video right now live. Share this if you want to, or if nothing else, I will post this when I'm done with this video. It'll be about a 10, maybe 15-minute video, no longer. This is going to be some really important information. While people are coming on, as I do on most of my videos, I want to talk to you about some of our success in the practice. We've recently had another patient go through one of our programs for our diabetes program, and again, we're able to reverse their diabetes. They were able to get off medications. They were able to improve their symptoms. They were able to lose weight naturally with little to no exercise. They were able to reduce the risks of their complications they were having. I mean, these are the types of things that we see every single day. This individual was taking over 3 different pharmaceutical drugs for his blood sugar. And as we were going through the program, he was able to get off the medications with the help of his physician, obviously, and reducing that medication. He's now feeling fantastic. He's doing great. He's very happy with the progress, and he's going to be able to continue that lifestyle that he was taught. So these are the types of things that we do in our practice. But today, what I really want to focus on is the one thing that you can be doing right now to prevent type 2 diabetes. Now, that can be a situation where somebody currently has diabetes or they're at risk. Maybe they have family members who have diabetes and they think that, hey, maybe I have a risk factor because my mom has diabetes, my dad has diabetes, my aunt, my sister's brothers, you name it. Or maybe they've been diagnosed with pre-diabetes, or they had gestational diabetes. You know the situation. If you know someone who's in that category, they really, really need to pay attention to this video, because this is one thing. It is the hidden secret, if you will, of why we help so many patients in our practice and how we're able to help them reduce their medications, how we're able to help them to reverse their diabetes. Yes, that is possible. We see that happen every single day in our practice. We see patients going from full-on, full-blown, out of control, diabetic situation to where they show no signs of diabetes on analysis. So what is it? What do we do here in our office, and how is it that we're able to help individuals, and what can you do right now to help yourself in the future to not ever be diagnosed with a diabetic condition, or actually be able to, if you have diabetes, to go backwards, if you will, in reversal to where you showed no signs of diabetes. So let's have a little conversation about diabetes first. In traditional methods, most of you would probably agree that your doctor would tell you, or maybe your nutritionist, healthcare provider, that most people are gonna have diabetes because of lifestyle. And guess what? They're right. The lifestyle does have a contributing factor to diabetes. But I can tell you this, lifestyle alone is not the only reason why people have diabetes. By making poor life choices, by eating appropriately, gaining weight, all the things that are shown to increase metabolic syndrome, increase insulin resistance, you're at a risk factor. But what if some other things are going on during that process when you have that poor lifestyle? What if during that poor lifestyle you are causing more underlying problems, more underlying issues that are maybe not surface problems that you can see symptomatically, but that are still problems that are contributing to your insulin resistance or diabetes? And what do I mean by that? Well, here's a perfect example. If somebody is eating poorly, maybe they're eating fast food all the time, they're not doing what they should be doing to improve their overall health. Now, let's just say that they go in to see their doctor one day and your doctor says, listen, you've got to make some changes. You're gaining more weight. I'm concerned about your numbers. Your blood sugars are on the rise. You're not diabetic yet, but you're moving towards that place and you're in a borderline diabetic state. Now, if that individual just goes and changes their diet and they remove all the bad foods, you would think that that would change and they would move on to become non-diabetic and reverse the blood sugars. Now, in most cases, that may be the case, but there are some people who remove the food and they eat healthier and they still have the problems. They progress. their blood sugars continue to rise and they continue to get sicker and sicker. Why is that? How is that possible? Because the lifestyle alone was not the only cause. The lifestyle created problems in the body that are still there that have not been addressed. And so the next step is to get them on a pharmaceutical drug, and they go on taking no medications to come out taking 1, 2, or 3 different medications. Most of you who are dealing with this condition, who have been diagnosed with diabetes or have had a diagnosis for many years, or maybe you have someone in your family have gone through this. You've seen this. I'm not telling you anything new. But there's a missing link here. There's a missing link that is being missed in most modern medical communities. Most healthcare practitioners are missing certain things that they're not done, that I want to make sure you understand that you could be doing today and that you should be doing on a regular basis, and all of your family should be doing on a regular basis, even if they're showing no signs of diabetes, but they could potentially developing problems. Before I do that, what I want to do is I want to talk about one other thing. Obviously, most of us know about this virus that's going on, COVID-19. I was just reading an article the other day that stated that if someone contracts, or whatever you want to call it, COVID-19, they get diagnosed with COVID-19, the virus, that they have a huge risk of developing diabetes, which I found very interesting. We know, and if you don't know, that most individuals who are dying from this virus have other problems, have other comorbidities, and diabetes being one of them. There's been some stats showing up to 30 to 40% of individuals who are dying from COVID-19, the virus, are due to diabetic conditions. So it's a huge risk factor. So now on top of that, if you get the virus, you have an increased risk of getting diabetes. What's interesting is that you may or may not have known this, but we've known this for many, many years. Not just specific to COVID-19, viruses in general, infection patterns, bacterial infections, viruses, yeast infections, parasites, all of these types of infections will increase your risk of developing diabetes. How? Because when an infection happens inside your body, the immune system is going to react and create a cascade of effects, including inflammation. That inflammatory response will put stress on those cells, which are supposed to be supporting your blood sugar insulin response there, and over time will create insulin resistance. So this virus is not any more problematic to diabetes than any other virus, like the flu or any other viruses out there that you may have. Epstein-Barr virus, all these viruses are going to increase your risk factor of developing diabetes and other types of diseases as well. So this is why it's so important right now, not tomorrow, not next week, not next year. Oh, I'll do this next time. Do not put this off anymore. You have got to take action immediately to protect yourself, to protect your family and your loved ones. This is why it's so important that you share this video today, that you bring people onto this video currently while I'm talking, or send it out to them when I'm done. Share it, because I will post it, and you want to share this video because it could potentially save someone's life. There are so many people right now that are living in fear. And I get it. I understand. People are dying. It's very scary. But this fear is because you don't have action steps. You don't have the ability to take care of yourself. Well, I'm going to help you with that. So here's what you have to do, right? And this doesn't matter what it is going on. I don't care how you're eating right now, if you're overweight, if you have a poor lifestyle, if you're not exercising, whatever that stuff is, none of those things matter at this point. Could they be contributory to your poor health and potential risk factors for developing diabetes, or if you have diabetes? Absolutely. If you change your diets, if you start exercising, and if you lose weight, either being naturally through hard work, sweat, and effort, or if you go under the knife and you get a surgical repair to make you lose weight. Either way you do that, will it help reduce your blood sugars? Yes. Will it reverse your diabetes? In most cases, no. There's more to it than that. You have to take more action. So what is it? What is the one thing that you should be doing immediately and should be doing on a regular basis? And that one thing is you need to have comprehensive testing. The comprehensive testing, not what you're currently doing. If you think that comprehensive testing is going to see your doctor and they're running your blood sugars, your hemoglobin A1C, looking at your kidney markers, looking at your cholesterol levels, and thinking that's comprehensive testing, Absolutely not. That does not tell you what the problem